enter the room.
Hello.
My name is Dr. Anam. I'm one of the doctors in the department. Am I talking to Shahid Alam?
That's correct.
Can you please confirm your age for me?
I'm 45, doctor.
Okay. How would you like me to call you today?
Shahid is fine.
Okay. Nice to meet you, Shahid. Shahid, I can see from my notes that you have made this appointment in order to discuss something. Am I right?
Yeah, I was actually hoping to discuss the X-ray reports. You know, they did an X-ray, so they said that you would be here to discuss that with me.
Okay, right. I will discuss everything with you and I will explain everything. But before proceeding further, can I ask you a few questions?
Yes, absolutely.
Okay, so why you had done the X-ray on the first place?
Oh, I kind of had a small incident at work where you know, I was carrying a pillow and I had a small accident where the pillar
Okay.
hit my shoulder. So I came into the A&E and they said that it was routine to perform this X-ray. So yeah.
Okay. Then, yeah. So, what you have been told about the the condition?
Right now they just gave me some painkillers and
Okay.
they took some blood work and that's about it. Yeah, and I'm just waiting to hear what you have to say about the X-ray. I'm just hoping that there's no fracture.
Yeah. Okay. So, can you please tell me a little bit more about your accident?
Well, there's nothing much, doctor. I accidentally hit myself with the pillow on the shoulder, and you know, it was hurting a lot. So yeah, that's why I came
Oh,
in.
sorry to hear about that. And are you all right now?
Yes, I'm better after the medication. Yeah.
Okay. So, what do you do for a living? Are you
Uh,
like, can you please tell me about your occupation?
yes, I work at the shipyard, doctor.
Okay. Okay. So, how are you feeling? Like, do you frequently had any infection,
No, not really. No.
any fever,
No, not really.
any chest pain?
No.
Okay. Any cough ever?
Not really.
How is your health in general?
I guess it's fine.
Okay. Okay. And now I will ask you a few questions regarding your general health.
Okay.
Are you suffering from any long-term medical condition, which I must be aware of?
No, doctor.
Are you on any medication?
No, doctor.
Okay. Um, do you smoke?
No, doctor.
Do you drink alcohol?
No.
Any weight loss recently?
I'm not sure, but my wife seems to think that my clothes are kind of getting loose.
Mm-hmm, mm-hmm. And any night sweats?
Not that I've noticed.
Any lumps and bumps in your body?
No, not that I've noticed.
Okay. How is your diet?
I usually try to eat everything, but these days I don't feel that hungry.
Okay. Okay. And are you physically active?
I just work and that's enough activity. I mean, nowadays I kind of get tired a lot. I'm just getting old.
Okay. Okay. So, Shahid, as we both understand that you had an incident and you came here to the GP and we have done all your routine investigations and we have done the X-ray as well. So today I will discuss all the X-ray result, all the blood tests and X-ray result with you. Are you okay to be on your own or you want someone to be with you?
I'm fine, doctor. I'm all right being on my own.
Okay, okay, that's good. Okay. So the X-ray report showed that there is some technique of the lining of the lungs, which we call the airways.
Okay.
Yeah. So I'm a little bit concerned about you. It could be something like sinister.
What do you mean sinister?
Like it could be something serious because the cancer of the lining of the lungs also present the same way.
I'm sorry, what? You're trying to tell me that I have cancer?
Well, sorry if I made you feel this way, but actually at the moment, the X-ray report is showing this. It could be something like other than this, but yeah, most the clinical picture is suggestive of this thing that it could be something serious.
How, how could this happen, doctor? What are you trying to say? I have cancer.
I'm so sorry, but you know, I can understand your situation. Everyone in your situation
2 minutes
is feeling the
remaining.
same. But don't you worry, I will explain everything that what we are going to do next. Is that all right?
Yeah, but how are you saying this is cancer, doctor?
I'm so sorry, but you know, the X-ray report is like a little bit concerning.
Okay,
Would you like to proceed with me?
all right, yeah.
Okay, so thank you. So for now, I would like to refer you to the specialist, to the to the lung specialist. It will be an urgent referral. They will see you in 2 weeks. Are you following me?
Yes, doctor.
Okay, and they will take some tissue from your lungs in order to see what actually is going on. They will check the tissue under the microscope, and then they will make a definitive diagnosis that what actually is going on.
Is this treatable?
Well, at the moment, it's difficult to predict what actually what actually is going on. I think they will be at a better position to tell you that actually the treatment depends on the stage of the disease you are having. So they will find out that what stage it is in, and then they will treat you accordingly, and then they will discuss everything with you.
How long do I have, doctor? How much time do I have to live?
Well, again, it is too early to predict. If you are treated on time, I think it will be helpful if you get treated on time. Yeah, we will try our best to refer you and to make sure that you get an appointment on time and you should be
Move on to
treated.
the next station.
Oh God, doctor. I was having palpitations.
Yes, it's definitely one of the most difficult stages that. So, doctor, with just pleural thickening, calling this well done, Dr. Arup, absolutely. So, yes, I want to ask you, with this pleural thickening, you're calling this mesothelioma.
I
What,
said it could be something other than this, but
but,
you know, to be on the safe side, we need to rule out the serious things first.
but
I don't know. I just remember the case of mesothelioma. I followed the structure like the same way.
what is the main thing about calling something mesothelioma, though? Anybody out there? Yeah, anybody have?
You were working at shipyard,
All right, but is that reason enough?
and
If
you
I,
were also having weight loss.
all right, but is that reason enough? What are you supposed to look for? Main thing. If you're calling this mesothelioma, the main thing that you have to look for. Anybody out there who has any comments? Anybody wants to say something?
Asbestos.
No,
Absolutely.
the patient was not smoking.
Patient was not smoking, doctor. Actually, I especially gave no smoking because this is one of the closest to lung cancer. You know, this is where there would
So,
be.
doctor, I mentioned that you were working in the shipyard, so that's why
But do
it
you
could.
know that shipyard I was exposed to asbestos?
Oh,
That's
okay,
something that you should ask, right? Have you ever been exposed to asbestos? You know,
okay.
yeah,
So, yeah,
a lot of asbestos. It's
okay.
I could be like a finance person in the shipyard working in one corner of one room. How could I be exposed to asbestos at all? You never,
I said that this is mesothelioma.
but you never saw the fact that it was asbestos. You never understood.
Oh,
At no point the talk about asbestos came up.
yeah, okay.
If you don't have that positive history of asbestos, were you exposed? So being a shipyard worker, I have a chance of being exposed. So asbestos was used, in a primitive time. So you need to,
Hmm.
if it's still in use, most of the people don't know that asbestos is something that can actually cause, such a long-term disastrous cancerous condition. So you need
Oh,
to look for that positive history. You need to ask him that, have you been exposed to asbestos? You need to get those words out. That's your exposure history.
okay,
Okay.
okay.
And this is an incidental finding, meaning this is a very gradual finding. Understand how long he's been exposed, right? Over here, these people are usually exposed for 20, like 15, 20 years in order to get this. Even after
Okay,
getting asbestos exposure, you might get a benign asbestos related pleural disease. How do you differentiate between a benign asbestos-related pleural disease and mesothelioma? Because now you got the flaws history. So you've got a pleural thickening on the X-ray, you have got a positive asbestos finding, and then you've got a positive flaws history, right? That's it.
okay,
That's what you're going on. So when I ask you how are you saying this, just with an X-ray, how are you saying that I have something like a cancer, right? You've not understood the fact, you've never come out with the fact that there was an exposure history, right? You need to
okay,
use those words. Shipyard is not it. Shipyard is it's a possibility, but ask, did you ever work with asbestos, right? Right. So that was one important point that I would say you needed to pay attention to. Use those positive history in making your diagnosis. So since I understand that you've come with, you came into the hospital with an injury on your shoulder
okay,
and you did an X-ray, and you mentioned that you work in a shipyard and have been working around asbestos. So in this X-ray, we actually found that the covering of your lungs have been thickened, and
okay,
unfortunately, this is one of the findings for, and you've been experiencing weight loss, and loss of appetite is also there, and he's also said he's tired, right? So
hmm,
see, all these features point towards a more sinister, diagnosis, something called mesothelioma. Have you heard of this before? Right? When we were like, what is mesothelioma? Like, that's such a complicated, bombastic name. We like, yes, unfortunately, mesothelioma is a type of cancer of the lung. You understand? So you are using all the positive history so all the history that you're taking, you're trying to get all the positive history, all the positive things that can, help you make the diagnosis. Do you
okay,
understand? So you just went on the fact that your X-ray has shown this, but apart from
okay,
that, you can also bring out the fact that since you have been expert and there has been a very high link between asbestos causing this type of cancer. That's what you
okay.
want to bring about to this patient. And why is this important to bring about to this patient, especially? Does anybody have any comments? Guys, anybody? Anything? You guys can drop a comment on the chat box as well. Cough up blood and exposed to asbestos at workplace. So coughing up blood and everything might not come, doctor. Sometimes this is an asymptomatic patient. So this is an incidental finding, meaning he doesn't have any symptoms apart from the weight loss. All right. So compensation, absolutely. There you go. That's why it's important, because this was a workplace injury. You can ask for compensation. That's why this is an important diagnosis to understand what has happened. All right. even if the insurer or the person, the shipyard, the company cannot compensate you, you can still ask for government compensation. There is a provision for these kind of diseases. All right. So that is a main management and will go a long way in this person's life and in person's treatment, getting a compensation. So definitely, that's what you need to ask about. Occupational health check. Ask about occupational health checks. Dr. Ambreen mentions that. Yeah, occupational health. Like, how would you mention that, doctor? Like, could you give us a little bit of an example?
Because he's working in a shipyard company or something, so there are regular health checks for those employees, those who are working there, regarding the exposure and all these things. So we can ask, are you been regularly following up with the regular occupational health checks, like is monthly, or how they were doing it for you? So
Uh,
we can get an idea when last time it was done and what were the findings, if there were any finding before in the chest X-ray, or
Absolutely.
yeah,
Yeah.
like that.
Yeah, that's a very good question. I mean, you know that they're working in the shipyard. You can actually ask, do you have an occupational, health checkup that you do regularly? Is that something that, your occupation offers, right? That's something, did they find anything in that? So basically, in this case, there is no positive finding for cough or any lung related condition, but there is a positive finding for asbestos exposure. The big clue over here is the asbestos exposure and then finding pleural thickness. That is a big correlation. If you see that, it's most likely to be this. And the point is, since that is a very likely diagnosis to be made, you want to talk about, the workers' compensation as well over here, right? So whenever you have an asbestos exposure and you have what we say a pleural thickening, it's an incidental finding of mesothelioma. So this is most of the mesotheliomas are actually incidentally found out like this. So when they actually made this case, they actually made it with that intention, that you actually make the patient aware that there is an entity of cancer that is involved with asbestos exposure that can present like this, right? So that you're prepared for this diagnosis. Does that make sense?
Yes, definitely. Like
You have
in
to
such,
confirm it. You
yeah,
definitely have to
yeah,
confirm.
we have to like, yeah, of course, we have to tell the patient in a very sensitive manner that this can be possible, likely diagnosis, but we are not sure. Like we have the suspicion for it, right? And
Yeah,
that's why we are referring you to the lung specialist for further biopsy and further testing.
yes, yes, absolutely. Another thing that you need to elicit over here is the duration of exposure. So that also has a big role to play. If it's actually for a long time, like these 15, 20 years of exposure, and this could be either a benign condition or it could be something more sinister as cancer. It's a little early to say, but we'll have to get it tested. That way it's just a normal way of saying it. But yes, Dr. Umbreen, go ahead.
Doctor, I want to ask about this compensation part. Can you please elaborate a bit about it? How to say this compensation?
All right. Um, so basically, the body that actually does give this compensation is called the Industrial Injuries Disablement Benefit. So you can actually apply for that claim and you can support it. Now, these are not something that you might actually remember always toward the exam, but you can always say that you can, since this is a work-related, injury or a disease that has happened, you can always claim for compensation since you were exposed to asbestos at work. And if you do remember, such a bombastic name, then definitely go ahead and drop it. That will actually give you some brownie points on that. Otherwise, just say that I can get you in touch with different, trusts that can actually help you with the compensation process. Yeah, or the claim for support. Otherwise, how to say it? So we have actually in this platform that we have built, we have actually put all the cases in a way there that, you know, you have the different kind of scenarios. You can actually see the different overviews of different cases. So Breaking Bad News, especially, we've actually broken it down into the spikes protocol, where, you know, how you know, break this news or how you actually present this news is very important in these cases, right? So so do go through these points. Breaking Bad News is actually free. So I'll just ask the moderator to drop a link of our platform so that you guys can check it out. And you know, especially since all of you have joined us today, we are actually encouraging that you guys do practice. And you know, we also have an AI simulator that you can practice with. So do try doing that. And as a special thanks to all of you that have joined, we are dropping a 40% off for you guys. So there is a coupon code that says special 40. So use that if you would like to buy our product. All right. So how to say this? So one good way that we have mentioned how to say this is the compensation, right? Right. If confirmed, you're eligible for compensation due to workplace asbestos exposure. You can say it as simply as that, or else you can say that, you know, I can support you in actually you know, registering for this claim. I can put you in touch with bodies that can help you in claiming compensation for this workplace exposure. Of all, you need to understand why he came to the hospital, and especially because this is an incidental finding, you need to understand, you know, if he is having any symptoms. So the thing that he came for is absolutely different from what you are going to talk about, right? So always understand the fact that whatever he's come for, he has been properly managed for that, and that was very beautifully done. Good job. I'm kind of blanking on who did this case.
I did this case,
Oh, yeah,
doctor.
no, good job. Good job on that. You had a doubt, Dr. Anu? You had raised your hand?
No, doctor. Thank you.
All right. Yes. So make sure that he is, you know, that part of the conversation is properly dealt with before you actually go into the more difficult side of things. So since this is something where, you know, you have found a pleural thickening, and you're trying to understand, like, what is the cause of this pleural thickening, especially since he has been asymptomatic. So you started by asking if he has any symptoms related to lungs, you know, any cough, any shortness of breath. And he says he doesn't. All right. So you understood the fact that he's asymptomatic. Now you understood that, you know, especially incident history itself, you understood that he works at a shipyard. So definitely confirm the fact of whether or not he was exposed to asbestos, right? Because that is what you're trying to bring out in this scenario. You're actually trying to bring out this difficult conversation. So you're looking for any positive symptoms. I mean, positive exposure history. And then look for the flaw symptoms. So you want some signs or some symptoms that actually elicit the fact that this is a cancerous kind of you know, it's heading towards a cancerous kind of a diagnosis. So definitely ask the flaws history, and that was beautifully elicited by Dr. Anu. You can just say that, all right, I have your you know, X-ray findings, and are you ready to actually talk about that? You know, like, redirect that entire conversation to the X-ray, that the entire focus of that person is there, right? Start with something simple, saying that, you know, so the X-ray was actually taken for your shoulder, and it doesn't look like you have any fractures, because he was actually concerned about fractures, right? Like, it doesn't look like you have any fractures. But unfortunately, you know, we have a positive finding in the lung. Like you mentioned, you work at a shipyard, and you know, you have been exposed to asbestos, and from what you've told me, you have been losing weight. According to your wife, you have been feeling tired more than usual, and you haven't been feeling hungry. All of this point towards a more sinister diagnosis, and unfortunately, in my opinion, this could actually mean you could have a condition called mesothelioma. That's why it's again provisional. You know, you could have, but there is a very strong possibility that you do. Right. So talk about everything that is causing you to say that. the asbestos exposure, the pleural thickening, and the weight loss, tiredness, and loss of appetite. All right, and then ask him, so what is it that do you know what mesothelioma is, right? And then go on to talk about explain him what the mesothelioma is. It is a cancer of the lung, more related to it usually happens when there is seen to have there has been some exposure to asbestos, especially in your case you have had that for about 20 years, and that's why I'm very highly suspecting that. And then talk about the further plans. So we suspect that you may have mesothelioma, a rare aggressive cancer that affects the lining of the lungs. It is most linked to previous exposure of asbestos. Unfortunately, if confirmed, mesothelioma does not have a definitive cure. However, there are treatment options like chemotherapy, immunotherapy, radiotherapy, and surgery that can help manage symptoms and improve the quality of life. Yeah, so that's one way that we have written it. Then go on to say that, what is your strategy? Yeah, emotions, definitely. After you drop a bomb like mesothelioma, wait for the patient to react, understand what's going on in his mind, right? Give him that space to actually, sink in that load of information. And then ask him how he is doing, understand what the emotion is, address that first. So he might be scared, he might be like what, and then address that. So we use something called the eve protocol here, where you actually address the emotion that you're actually feeling from the simulator. That would be, I understand that you could be you could be confused about this, and anybody in your position would be, this is a very difficult news to take in. However, then go on to your strategy, where you're actually talking about what you're going to do. So in this case, you will be referring them to the specialist. So mention that, mention what the specialist does, right? And mention all the treatment options that you can offer him in the form of, radiotherapy, immunotherapy, surgery, chemotherapy, right? And then talk about the compensation. That is very important in this case. Why? Because compensation in this case is something that can improve their quality of life so much more. So once mesothelioma is diagnosed, it has a very bad prognosis. Most of the patients with mesothelioma don't make it more than, I think, 3 years, if I'm not mistaken. But I think I read it 3 years, but they don't make it for long. So it has a very bad prognosis, by the way. So make sure that you mention that to him, so that it could benefit him, not just him, his family, if at all they were diagnosed, right? But over here, like Dr. Dr. Saman had mentioned, that it can also be the benign condition. As of now, we haven't diagnosed that yet. Bring that in. Say that the specialist will actually be doing some special investigations where they will take a tissue of your lung and be confirming this diagnosis, right? And if you would want to bring in that fact that it could be a more benign condition, say that at some times the tissue of the lung covering can react to asbestos and not cause a cancer. This is called benign, benign asbestos-related pleural disease. So say that this can also be that in this case,